Social prescribing is fantastic. It connects primary care to the community with the voluntary sector and all the organisations that work in the community to support residents and patients.
Because we find a lot of the patients, they don't know about the services that are basically operating on their doorstep. So for example, welfare support, volunteering opportunities, they're unaware of how to get involved in those services.
And with social prescribers, they know what's available locally. They can make contact with somebody, point them in the right direction, and make sure that they get the service they need.
The other thing that social prescribing does is unlock the assets within communities. And the very people who get socially prescribed end up becoming part of the assets of that community and contributing to those groups and activities themselves as well. So you turn people who present needs into people who become assets and get involved and then go on to support others themselves.
GP practices shouldn't be sort of standalone services within a community, and really should try and be a beacon of good health within their communities. And one of the really important ways to do that is to connect with local services.
It's an opportunity to do something different, which means that you can work with communities to make the community more resilient and connected as well.
That's where the resources and wisdom is in your community already. You don't need to come to us, and actually evidence is you'll do far better if you're linked back into your community.
And referring those patients to those services also helps to increase those community services to exist and to maintain, get funding. We're able to keep those links alive and also keep the GPs aware and updated with the services that are currently running in the community.
When we're discussing social prescribing, we need to discuss the services that are joined with it. Otherwise, one can't exist without the other.
Social prescribers, we refer patients to programs, but it's all well and good us referring patients to programs, but if there's no funding for the programs, there's only so much social prescribers can do.
It's really important that local authorities invest in these programs. Everything from education to housing, any form of social welfare, healthy eating, exercising.
Council is hugely important, and they are buying in and they do believe it. We've done a lot of work with our council and they are as equal as key players in this.
Unfortunately, lockdown has kind of impacted on the number of organisations we had access to. A lot of them have lost funding, haven't got the capacity or the availability at the moment. So I think it's really important, if you really want to reach your communities, we need the organisations out there and available.
Social prescribing team members are a huge and important resource for commissioners. They are the people with the knowledge about what's going on under the radar.
We also understand that sometimes there'll be things that are missing, and that if we link with people and speak with people about that we might be able to fill those gaps.
And I think that helps commissioners like myself and my colleagues to look at better informed decisions around how we design services.
We're able to then go to the community sectors, go to the statutory service and say, this is a gap in the service, there's this gap, and there's these patients that can't access the service, so we can actually help support those community groups to create those services.
Before, we were only getting information from people that were already using the health system that were ill. Now with social prescribing, we're looking at people that are at risk of certain conditions and illnesses and tackling those issues head on prior to them getting unwell. That is the only way that we are going to improve the health of this nation and improve us going forwards as communities.